Hello, I'm Dr. Ruth Roberts, your pet's ally, and I've got a bunch of answers for you as well as some information about some things you should keep in your emergency kit for your pet. So, first of all, let me answer the questions. Kevin is writing in and asking about his dog Sabrina, who is 10 to 15 years old. She's an American Eskimo dog, and she's got early kidney disease. So her BUN is 57 and creatinine is 2, and all the other stats are good. And the vet's recommending the kidney diet and couldn't really offer much else. So Kevin, here's what I would suggest to you. The creatinine is really pretty good at this point, especially given her age. And so the renal diet will indeed bring it down because we are reducing protein with kidney diets. And I think what's important to note is that at Sabrina's age, she also may start to drop muscle mass. And that's not in her best interest. So home cooked food, canned food, those are good options with moderate protein. You may well see the creatinine drop down simply because of that. The other thing is quercetin is a home run as far as uh, helping to improve kidney function. So check that out, and definitely, check out the kidney program we've got available. I think that's offered a lot of people a lot of help. And certainly I'm available to do consultations for you if you need more additional help. So Kevin, I hope that's helpful. Um, Lina Rains is writing in about her dog Shiloh, that's about 2 to 3 years old, and a Shiloh Shepherd dog. And unfortunately, Shiloh has loose stool. And Brenda Robbins is also writing in about Dudley, her Lab Great Dane mix, who's a bit older but also has really, really loose stool, like pudding for several weeks, and then, yuck, poor buddy. And then also has dry skin, clumps of dry skin and hair. So, sounds like neither of these guys is having too good of a time. So, for both of you, if the stool being loose is relatively new, meaning 4 to 6 weeks, one of the first things I would suggest doing is talking to your vet and getting something called a fecal PCR test done. And what that does is test for organisms that won't normally show up on a fecal test for parasites. And these are things like C. diff, Campylobacter, Salmonella, things of that nature. So get that checked out because those are all things that you can catch and your family can catch as well. Now, if you've already gone that gamut, many times this kind of chronic loose stool can be due to food sensitivities, things of that nature. And so that's where things like the Glacier Peak Holistics test, I think, can be very helpful as a roadmap for what foods to feed and what foods to avoid. And then symptomatically, you can use things like activated charcoal and then super high doses of probiotics. Now, Brenda, for Dudley, if the skin issue has sort of come to a head about the same time as the diarrhea, that may be related to malabsorption of the food, but it also may again be due to food allergies or sensitivities. So shampooing frequently will help symptomatology, and then also using apple cider vinegar rinse. So an ounce of apple cider vinegar to about a pint of water, and literally bathe your pup, wash off the shampoo, and then sort of sponge on this apple cider vinegar rinse, and that helps to kind of kill things back a little bit as far as yeasts and bacteria, things of that nature. Now, this is another place where getting the Glacier Peaks test can be extremely helpful. And then, strangely, probiotics, super high doses of probiotics, both for the stool issue and the skin issue, and then high doses of essential fatty acids. So I hope that's helpful, Brenda. The last question I've got for you today is from Angela, and her dog Zoe is a little Chihuahua, and she's 16 years old, which is really quite ancient. And unfortunately, she started having seizures about 7 months ago after a dose of Trifexis. and she's also developed lameness in the rear end. So, Angela, talk with your vet if you haven't already. It's concerning that the trifexis kicked off the seizures, but ultimately, what's more worrisome is that at 16, the sort of the unthinkable of brain cancer may be present. So this is where keto diet can be extremely helpful. And then if you check out the brain support protocol, there are several other things that may help with the seizures as well. And then I would just double check with your vet that the seizure issue and the rear end weakness are not related, because if the nerves aren't firing correctly in the brain or in the cervical vertebrae, then the back end's not going to work very well either. So I hope that makes some sense. Um, if you would like to ask me a question, just message me here on Facebook or head over to the website, drruthroberts.com, and then just click on that button that says Ask Dr. Ruth, and I'll be happy to answer questions for you. Now, the other thing I wanted to talk with you about today is sort of an emergency support protocol. And there are some really common things that happen to pets that if you're prepared for them, you may be able to handle much of the issue at home, or at least make it not such a mess, particularly in the situation if your pet's been cut or injured, that you're able to get the wound cleaned up and protected really quickly. So, these are the things you want to kind of plan for. These are the most common emergencies that people needed help with. So, here's what we've got. So, tummy upset, gastroenteritis, bleeding or trauma, injury or overdoing it, and then having to take emergency travel if your pet's anxious. So the things I want you to kind of think about is tummy upset is like the most common thing ever, right? This is from eating something funky, or sometimes you really don't know why. But with vomiting, the first thing is that you want to withhold food for at least 12 hours, and you do want to limit access to water. What happens many times is if your pet starts vomiting, they tank up on water, they throw that right back up. So offer water in small quantities, and then ice chips is another good option as well. And then sometimes activated charcoal can be really helpful as well. So once the 12 hours has passed and no further vomiting has happened, then offer something super bland like rice or boiled potatoes or something like that, and add in a little bit of probiotic. And again, you want to go with a super small meal, so literally an eighth to a quarter of what your pet would normally eat. Now, if your pet's vomiting and it's not able to hold water down at all, then that's the time to go see your vet. Dehydration can happen really quickly and create problems. Now, if your pet's got diarrhea, you can try again offering simple fiber-rich foods, so things like potatoes, turnips, sweet potatoes, and that's going to help kind of bind up the stool a bit. A banana and pumpkin are not a bad idea, and then probiotics and activated charcoal can really make a big difference. And again, if the diarrhea goes on for more than 24 hours, or if your pet's had like 5 episodes of diarrhea in 3 hours, you definitely need to go ahead and get on down to the vet's office. So the next thing is bleeding or trauma. So, many of these deep cuts, you really do need to get them sewn up. But getting them cleaned and applying pressure to the wound can make it easier for the veterinarian to get the wound closed up, and it will make the healing happen much more quickly, and prevent bacterial contamination of the wound. Now, one of the things that I used to love having in practice was Yunan Bai Yao, and it's actually slightly misspelled here. Why it's got an end on the end here, but we would use it for dogs that were really older and obese when we had to spay them, and if they had really serious bleeding issues. For hemangiosarcomas, this is one of the go-to herbs because it does help prevent bleeding, but it also seems to reduce vessel growth into the tumors. So this is a great emergency drug as well. So there is a little red emergency pill in the center, and so you would want to use that if your pet is bleeding profusely. Otherwise, 1 or 2 capsules of the Yunnan Baiyao every 6 to 8 hours should be fine to keep things under control. The other upside of Yunnan Baiyao in a trauma situation is it does seem to help reduce pain as well. So I've got a link down there to that. The other thing that scratches or not just abrasions, things like that, cleaning the wound, keeping it clean and dry, and then putting a bandage on to protect it for a couple of days. So oftentimes your pet can do more damage to themselves than whatever the original trauma was. So having a bandage on is useful, but also having an Elizabethan collar available can be really helpful too. So you'll want to get some gauze squares, a little bit of vet wrap. Don't clean with peroxide, just plain warm water is best. And then again, for bleeding and lacerations, things of that nature, Yunnan Baiyao is awesome to have on hand. Now, one of the other big things that pets do is overdo it, and just like us. So you'll want to, kind of bear that in mind. If your pet's not really exercising well, or often, I should say, then don't do a 5-mile walk. Do, a half a mile, something like that. And watch your pet. If they're starting to pant like crazy, things of that nature, grooming themselves, drinking, just all sorts of stuff, this can be an indication that it's time to go home. And if this is something that they're doing at rest over several days, this can be an indication of chronic pain. So if your pet is well enough and has had pain issues in the past, keeping some sort of a non-steroidal anti-inflammatory in your emergency kit can really save the day if your pet's done just way too much. This is a prescription medication, so you do need to make sure your veterinarian is okay with it as well. Now, the other thing that you can use are some herbal formulas called Inflapotion and Herbaprin. They're made by Glacier Peak Holistics. They are really fantastic products. The Herbaprin, they do say you need to be careful with in cats because it does contain willow bark, which is the precursor to aspirin, salicylic acid. So cats can tolerate low doses of aspirin, but probably best to stick with something like Inflapotion just to be safe. And then lastly, emergency travel. And, for those of us that live in the coast where we're prone to things like hurricanes and things of that nature, everybody's got a hurricane kit. And for folks that live in California or other earthquake-prone areas, same idea. You want a grab-and-go kit for your pet as well as yourself. So because emergencies tend to be really stressful, and if your pet's not accustomed to traveling frequently, liquid Nutricalm, which is a tryptophan-based supplement, can be a lifesaver. The other thing you want to make sure you've got with you is the rest of this emergency kit, because tummy upset happens with stress. You're in a strange area, it's more likely that your pet can injure itself. And then just, being in a car for 8 hours, if your pet is older and has arthritis, that can create some pain as well. Make sure you've got some other items like a portable water bowl, collapsible crates, and then towels and blankets as well. So that's what I've got for you today. We still have an amazing deep discount sale going on with Holistic Total Body Support. And if you have not used it before, it is a wonderful multivitamin made with glandular support. So I designed it and was so pleased with it, and I've seen so much happy reports from pet owners as far as how much their pets have improved once they've started this. So head over to the website, drruthroberts.com, click the shop button, and I'll put a link directly to it as well. But you can get holistic total body support for as low as $8.80 a jar, including the shipping. So go check that out. And that's what I've got for you this week. Until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally.